Hello, everyone. It's so nice to be here with you all. I'm very excited to be speaking at the very first Spotlight Series talk. So I'm just going to share my screen here. And is everyone able to see my slides okay? Perfect. Awesome. And let me see, I'm just moving everything so that I can also keep track of the time. So as Leah said, I'm going to be talking today about some of my research around the role of critical reflection, particularly in supporting documentation. And I'm looking forward to talking about this more with you all in the Q&A and discussion section afterwards as well. So I think probably everyone on this call is very well aware that documentation is a big part of OT's day-to-day work. And depending on the context, this can include writing reports, writing SOAP notes, therapy goals, intervention plans, progress notes, various types of letters, notes or emails to teachers or parents, discharge summaries, lots of different types of documents. And these documents travel within and across the school system, the rehab system, and the healthcare system, depending on the child and their needs. And so as documents travel across these various systems, we all, I think, also know that they serve many different functions. So they can be a record of services and supports. They're a way to transport children's information from one context to another. They can be a means of communication amongst professionals who are working in different spaces. Sometimes they're the only form of communication between different professionals. They can also be a tool for collaboration to help to support service delivery and continuity of care. And they can also be tools for advocacy, so to help children access things like funding, equipment, and other services and supports. And different types of documents can also serve multiple functions depending on the situation at hand. So a letter, for example, maybe written for a child, it could be used to help them access particular equipment in one situation. But in another situation, a letter might be used to help build a relationship with the teacher. So the same types of documents can serve different functions depending on the context. And so I'm really looking forward to kind of digging into how we can leverage documentation in OT work. And to kind of get us started, I wanted to start with an example of a particular note just to kind of ground us. So on the next slide, you'll see a note about a fictional child named Amara that an OT might have written after their visit with Amara in her classroom. And as you read the note, I'm hoping that you can imagine that maybe you're starting at this school, you're starting at Amara's school as the new OT, and Amara will be on your caseload. And you haven't met her yet, but you're reading this note written by the previous OT before you visit her classroom. So I'll just give you a minute to read. Apologies for the a lot of text on one slide, but hopefully you're able to read it okay. So again, this is fictional, but likely similar to notes you have written or notes you have seen. This was written with the help of an occupational therapist. And I would imagine, I would guess that you're probably starting to build a picture of Amara in your mind as you are reading this. So maybe who she is, what her needs are, how you might work with her. And I think that's kind of the point of documents. They're meant to help shape our understanding and help guide our next steps. So I'm hoping that you'll keep that picture that you're maybe starting to develop of Amara in your mind as we go through the talk, and then we're going to come back to this note in a moment. So documents written by health professionals carry power, and there's many scholars who have written about this from all different professions. So what is written and also how they're written shapes and constrains what we see and also what we don't see. And what's written and how they're written also shapes our actions, the things that we do and the things that we don't do as a result of that documentation. And so the note, Amara's note, for example, written by the school's previous OT, could have the potential to influence how you see and how you work with Amara, maybe the goals you set, the interventions you try out, the supports you put in place, maybe also how you engage with her teacher or her family, if that opportunity arises. So documents really carry power to shape the things that we do in our practice. And so in my research, as well as research led by my colleagues, we've seen that clinical documents can actually be a vehicle for or a lever for change. And we've seen that some health professionals, or for some health professionals, documentation is not just about recording information, that's one purpose, but they also will strategically leverage documents in ways that help them to better support children, to navigate or remove barriers that children and families might face, in ways that help to support participation and inclusion in classrooms and schools, and also enable access to services and supports. So in one study led by Stella Ng, who is a pediatric audiologist and researcher, the 22 Ng and Al 2022, the third reference at the bottom of the slide. In that study, we looked at how health professionals working with children with developmental disabilities, so developmental pediatricians, family doctors, OTs, SLPs, we looked at how they write and use reports and letters that were sent to the school to help coordinate services and support. So health professionals who are working outside the system but sent their documents to the school. And in that study, we found that some health professionals very intentionally use their reports and letters to do a number of different things. So one thing that they did was really use their documentation to explicitly value and leverage different forms and sources of knowledge. So really valuing and honoring the child and family's knowledge, but also the teacher's knowledge. And that was very explicit in the way that the documents were written. They also use their documents, their reports and letters to identify and communicate workarounds. So ways of helping children access services in a kind of imperfect system. So when it wasn't always possible, figuring out the ways that they were able to kind of work around barriers and find creative solutions in often very limiting systems and settings. And what was key to that part, that it wasn't just about identifying workarounds, but also communicating those workarounds to families. So telling them why they were using their documents in certain ways so that it was clear to families what the strategy was. We also saw that these health professionals would use their documents, and it became clear in the way that they were writing that they were able to see and respond to inequities and gaps in service. So they were noticing when certain children were struggling to access school-based services, or certain families might be struggling based on their background, sociodemographic status, that kind of thing. And they were able to figure out ways to respond to those inequities through their documentation. And then the last thing we found in this particular study was that these health professionals use their documents to advocate as collaborators, not as adversaries. So they were advocating with children and families and teachers rather than kind of against the school system. And so the way that this kind of group of health professionals was using their documentation was quite a big contrast to what we were seeing elsewhere, and also what's been documented in the literature in general, where we've seen that traditional documentation practices, things like reports and letters, can often unintentionally reinforce inequities. They can contribute to inefficiencies and delays in accessing services. They can sometimes reinforce gaps, and they can also sometimes put undue burden on families who are often already disadvantaged by the system. So when we looked closely at what these practitioners were doing and why, we found one common thread. And that was that they were all engaging in critically reflective practice. So we found that when health professionals when they reflected critically on their documentation practices, they were able to use their documents as a lever for change to better support children. So what is critically reflective practice? I'm going to talk a little bit about what it is and what it looks like. So critically reflective practice is a way of practicing that involves examining individual, professional, and societal assumptions and power relations, and how these assumptions and power relations shape one's practice. And what's interesting is that critical reflection for occupational therapists in particular is part of the new COTIP framework, the Canadian Occupational Therapy Interrelational Practice Process. I think that's it, COTIP. It's a long name for a short acronym, but critical reflection is a key part of that. It's one of the three foundational processes. And critical reflection really goes beyond self-reflection, reflection kind of that inward looking, focus on your own beliefs, to more externally looking ways of thinking about existing social systems and structures and how they can keep inequities and injustices in place. And so, thinking about the way that when assumptions and power dynamics contribute to harmful or limiting practices, critically reflective practice would involve taking action to try to mitigate those inequities and injustices. And that's what we saw many in the prior research doing. So, critically reflective practice really allows for OTs, I think, a way to think about the ways that everyday practices, so maybe writing a SOAP note or generating an assessment report or writing an advocacy letter, thinking about the ways that these documents are shaped by broader social and structural forces that tend to be taken for granted. So, how they're shaped by, siloed work processes, the school versus the rehab system, time and resource constraints, hierarchies of knowledge, maybe between healthcare providers and educators or families, interprofessional power dynamics operating in these spaces, even different ways of thinking about the goal and purpose of occupational therapy. All of these things are shaping documentation in ways that we don't often realize. And so I also, just to go a little bit further in terms of what critically reflective practice is, I wanted to share this diagram on the right that was created by a colleague of mine, Brett Diaz, because he kind of breaks critical reflection into three related parts as this ongoing process. And I think it's a helpful way of thinking about it. So he's broken it down into this idea of questioning, for one, questioning and examining the things that we tend to take for granted as normal. Two, reimagining how those things could be different. And then three, I think the most important part is taking informed action. And action in this sense would be through the things that practitioners are already doing in their everyday work. So shifting how you write a report, shifting how you communicate with a child or with a teacher, shifting how you collaborate. So using critically reflective practice is all about using these everyday practices as opportunities to challenge and change inequitable assumptions and power dynamics. And so Elwani Ramagondo is a South African occupational therapist and researcher, and in her work on occupational consciousness, which comes actually from a lot of the same literature as critical reflection, a lot of the same critical scholars, she says that everyday doing, while the most difficult thing to change at individual or collective levels, is probably the most powerful mechanism through which to resist dominant practices. So again, this idea that your everyday practice is opportunities for change. And so when it comes to documentation, this is really important because clinical documents, like all texts that we use in our lives, reflect and reproduce dominant assumptions, beliefs, and values in healthcare, rehabilitation, and in society more broadly. So things like whose knowledge counts, whose voice matters, what the goal of care is, all of those things are reflected and reproduced in the way that we document. And as health professionals move through their training and through their practice, they implicitly and explicitly learn these routine practices and start to adopt them. And I think because documentation is such a big part of most health professionals' jobs, routine practices very quickly become taken for granted. So we start to do things in a particular way without even really thinking about it. So critically reflective practice invites us to step back and examine why we write the way we do, consider the impact our words may have, and then shift our language to challenge harmful assumptions and practices. So I want to talk a bit about, or think a little bit about how this can actually impact the way that documents are written. And so going back to Amara's note, this is the same note that I showed at the very beginning, just to refresh your minds. Um, but in thinking about how a critically reflective practitioner would reapproach this particular situation with Amara and maybe how they might document it a little bit differently. So what would critically reflective practice kind of look like in terms of documents themselves? So a critically reflective practitioner would continually question the way documents carry intended and unintended meaning, reproduce or resist social norms, and shape individuals' identities and possibilities. And that's a quote from Stella Ng and colleagues. And so in this particular instance, in Amara's instance, this might involve recognizing the way the biomedical discourse often pervades the way that SOAP notes are written, as well as almost all documents. So a critically reflective practitioner might question the ways the biomedical discourse contributes to deficit-focused language that frames children primarily in terms of what they can't do, and also often overlooks children's agency. And she might also consider what that means for Amara, including how she sees herself and how she's seen by others. And so thinking about the ways that the effects that this approach could have and potentially the harms that it could cause, she might begin to reimagine. The OT might begin to reimagine how she can write about Amara's needs, focusing on her strengths, preferences, and self-advocacy, and reframing challenges in a way that might open up possibilities rather than shutting them down. And then in light of these reflections, she might take action by shifting how she would typically write her note. She might instead choose to center Amara's participation and choice and come up with a plan that's not just about kind of quote unquote fixing, but creating environments and strategies that support self-efficacy, inclusion, and belonging for Amara. So on the next slide, I'm going to share Amara's note if it were rewritten from this particular critically reflective lens. And so again, I'll just give you a moment to read, and then we can talk about it. So I imagine you're noticing some differences. I think there's a lot. If we had an endless amount of time, we could unpack both of these notes side by side. I think we could spend a whole hour talking about them. But a few things I just want to draw your attention to, though I think there's many more. Um, One, I think, is around the way the voice of Amara comes through differently in this letter versus the previous one. So I think in this second note, there's much more of an emphasis on Amara's preferences and her own self-advocacy in a way, and documenting those as strengths rather than barriers. I think there's also a shift from more of a deficit-based language and lens to a more of a strengths-based orientation. So again, just even things like required 4 verbal prompts to refocus versus here responded to 4 verbal prompts. So little shifts in the language that shift away from that problem-focused way of looking at Amara and her needs. I think also in terms of the plan, shifting from kind of trialing tools for Amara versus offering options that allow for her own decision making and her own choice as another distinction. And kind of this idea of the interventions being applied to Amara versus being developed with her. So those are a couple of the kind of shifts. And I'm happy to chat more about what else you're noticing in the discussion portion. But I do want to emphasize here that while there are shifts in language, it's not just about critically reflective practice here is not just about choosing better words, and it's not even just about strengths-based language, though that is one way I think of illustrating a critical approach. But really thinking about how the use of language, how we can use language and shifts in language to challenge problematic practices. So in this case, a deficit-based approach to thinking about Amara and her needs. So this is sort of to highlight one example of critically reflective practice. So the previous research that I was talking about from myself and my collaborators showed that health professionals who practice in a critically reflective way shift how they write and use clinical documents to remove barriers and better support access to services and supports. And so in our most recent study, the one I'm going to talk about today, cited at the bottom here, we wanted to look at what happens when health professionals write in a critically reflective way. So how are critically reflective documents received by others? And how can they change the way that school-based practice unfolds? What outcomes do critically reflective documents have? That was kind of our key question for this particular study. So we designed a critical qualitative study to explore, in particular, how parents and educators of children with disabilities reacted and responded to letters that were generated through critically reflective practice. So in this study, we were looking at letters that maybe they were fictional, but the context behind it was that they would be written by a health professional working outside the school system that would then be sent to a child's school to communicate their needs. So looking at letters rather than SOAP notes in this case. So I'm going to walk us through the study and what we found for the remainder of the talk. So this was our research question for the study. What are parents and educators' reactions and proposed actions in response to critically reflective letters? So again, the aim was really to start to get a sense of how critically reflective documents impact the way that school-based practice, what it looks like, and how it kind of transpires from the perspective of parents and teachers. So we conducted 1-hour semi-structured elicitation interviews with 9 parents and 8 educators of children with disabilities in Ontario. And educators included classroom teachers, resource teachers, and 1 principal we had. And so we used 4 letters based on, as I said, fictional but representative children with developmental disabilities. And we used those letters as elicitation tools. So before the interview, I shared one of the letters with participants, and then kind of shared the letter, as well as there was a short narrative about a third of a page that provided some background and context on the situation of why a letter was needed to be sent to the school. So just a bit of background to kind of set the stage for the letter. And so these particular letters they came from a previous study, a prior phase of this work that was actually part of my PhD work, where we created fictional cases of children with developmental disabilities, and then we asked health professions learners to write hypothetical letters to the school that would help coordinate services for that child. So they were written by learners, and they were fictional, but the goal of the study was to kind of look in this hypothetical situation, what might happen if that letter were to reach the school system as a kind of initial first study in understanding the outcomes and impacts of a critically reflective approach to documentation. And for the analysis, we used a constant comparison approach, and our goal was to generate a map of potential outcomes. So this was the map, or I guess it turned into a cascade that we generated. So through that analysis and through that study, we found that critically reflective letters had the potential to spark a number of outcomes. And we grouped these conceptually. You can see in the boxes along the top as humanistic outcomes, communication outcomes, collaboration outcomes, and advocacy outcomes. And as we were mapping their interrelationships between them, it really became clear that they were kind of taking shape as a cascade. So, this critically reflective approach to thinking about documentation led to humanistic outcomes, which then could spark shifts in how communication, collaboration, and advocacy unfolded. And together, all of these outcomes had the potential to influence, or at least participants felt that they had the potential to influence how services and the delivery of services and supports for children at school. So just for the sake of time, I'm going to zoom in on 5 of the outcomes, but always happy to chat about the others. And of course, the paper does talk about them in depth too. So I think the really the main thing, one of the biggest things we heard was this idea of rehumanizing children as a key potential outcome of a critically reflective approach to documentation. So parents and educators spoke of letters that they typically receive for their own children or their own students as, and I'm quoting here, clinical and frustrating and dehumanizing. Whereas in contrast, they described critically reflective letters as, quote, more human and personal. And one parent said, this letter explains Lucy. Lucy as a person, not Lucy as a clinical study. And Lucy was one of the fictional children. Um, and so participants also suggested that this rehumanizing of children through documentation could have the potential to shift how they're seen at school. So one teacher said, when you've got a clinician who's respected and who's speaking to the strengths of the child, who's speaking to the needs, and who's speaking as warmly as they have here, that can have major impact. I've seen people change their way of thinking about a child at these meetings when someone is advocating and seeing them as a human being as opposed to a problem. So we heard that a critically reflective approach really painted a picture of children as individuals with unique strengths, aspirations, and needs. And like we saw in the note with Amara, challenging that dominant deficit-based approach that is common. Um, and parents and educators really felt that this could have powerful effects in terms of shaping how children are seen. But not only just shaping how they're seen, but also having very sort of practical and concrete effects as well. So especially educators talked about the way that this humanizing approach could actually provide them with a clear understanding of the child's needs and goals and what their diagnoses actually mean for them. So educators felt that this approach to writing about children actually better equipped them to be able to identify what the child needs and figure out what services and supports were required in a more timely fashion. So one teacher said, I can start working on some of these things, or I understand better what the child's needs are or the issues that are being brought up. If I feel like I can't understand what's going on, it's going to limit how much help I can provide. And this was also in response to some of the jargon that often comes through in documentation and, the different languages between practitioners and educators and how that can sometimes become a barrier. So as we started to think about, or we looked in the data at what this sort of rehumanizing approach, what that then led to, we found that rehumanizing children could have the potential to shape how communication unfolds by supporting improved receptivity at the school. So teachers, resource teachers, and the principal all reacted positively to the letters, which they described as quite a bit of a contrast from their response to documentation that they typically receive, which can sometimes put them, and quoting again, on the defense. And they really cited that this rehumanizing language is the key kind of factor that was shaping their response and leading to this more open response that they felt as they were reading the letter. So one teacher said, in my head, I was swearing, a letter from this hospital. They're just going to dehumanize this lovely little girl and not understand her at all. But then, and here she's quoting what's written in the letter, it's my understanding that Kai's mother is being called most days to pick her up after only a couple of hours in the classroom. And like, oh yes, this medical professional is on the side of the child, which is excellent. So now I've bought in, right? So what we found was that this rehumanizing approach kind of helped secure educators' buy-in and set the foundation for a positive interaction. Um, and so the other kind of communication piece that we found was that even though communication in this setting in particular, especially with reports and letters, communication is often one way, a report or letter is sent from the clinic to the school. Participants suggested that letters may create opportunities for bi-directional knowledge sharing. So one teacher said the important points are in here, but it's done in an open-ended way, also leaving room for the regular classroom teacher and special education teacher, that they may have some other information that would be helpful to share. So they talked about the way that the letters used a kind of open-ended and dialogic language, um, which started to challenge some of the typical dynamics and sort of one-way movement of information in this context, and actually work to position the letter as a starting point rather than an end point for communication. Participants also suggested in the study that the letters may help to create stronger partnerships between families and schools. So one parent that we spoke to said, in this case, it was a developmental pediatrician. With all their letters behind their name, they're taking Lucy's mom and dad seriously and saying, no, they really don't think that they really do think that there's a lot of potential here, and I believe them, so let's all believe them. That stood out to me. I would hope that that would facilitate a change in the way that schools work with families. So we heard a lot in the interviews with parents how they often feel excluded from or even pitted against the school team. And they felt that a critically reflective approach set a tone for partnership with the school by valuing the family's voice and perspective and positioning them as active team members working towards a shared goal. And so, in light of these shifts in communication and collaboration, participants suggested that the letters could foster an increased sense of support for families. So, one parent said that having this letter could feel like somebody else is on my team because it always feels like we're very much alone and it's up to us to pull together a team. And so, in this letter, it sounds like somebody is putting all the pieces together as opposed to only dealing with siloed care. And so parents consistently contrasted this kind of feeling of support with, in their words, the loneliness and frustration that they often experience when advocating for their own kids. And many emphasized how, you know, documents being able to offer that type of support would be especially important for equity deserving families who may not have the access, the ability, or the resources that they need to advocate for their children. So participants felt that this critically reflective approach could contribute to a kind of shared sense of advocacy rather than placing the burden on families to kind of bridge the health and school systems. So those were some of the key findings in terms of the potential outcomes of a critically reflective approach to thinking about documentation. And just wanted to zoom in on a few again for the purpose of time. But overall, as parents and educators were sharing their reactions and responses to the letters, they really began to highlight how these different outcomes together would have the potential to impact the way that services and supports are provided. And they felt like the particular kind of opportunities could be around, first of all, improving access, and also they talked about opportunities to potentially reduce the time that it takes to implement some supports because they felt that collaboration and communication might go more smoothly. So, just to kind of talk about some implications and conclusions of what this study means and what it tells us. I think one, it tells us that a critically reflective approach to documentation does have the potential to shape the way that school-based practice unfolds. And in particular, the findings highlight the role of critically reflective practice in supporting a humanistic approach to documentation. And the cascading nature of the outcomes suggests that a humanistic approach might be a necessary precursor to meaningful communication, collaboration, and advocacy, particularly amongst health professionals, school professionals, and families. So this was something, this, as I said, this humanizing approach was something that parents and educators immediately noticed and really appreciated in terms of the way that children were written about differently. And they felt that it was kind of like a domino effect. It set the tone and then shaped everything else that would potentially come afterwards. And so, again, I just want to emphasize that this sort of I think humanizing approach in this particular instance, we did see very much aligned with a strengths-based affirmative approach. So I think that captures one example of how critically reflective practice can rehumanize documentation in the way that a strengths-based approach allows us to counter and challenge the dominant deficit-based kind of problem-focused biomedical way of writing that often pervades documentation. And kind of final thought and final implication of this work, I think, is really recognizing that critically reflective practice is a continual and ongoing way of practicing, so it never stops. Um, because new language will simply reflect new assumptions and new power dynamics. So it's really always kind of having that critical lens on what you're doing, what you're writing, and why, and thinking about the effects that that can have and how it can shape things for children. So just to conclude, I wanted to just also remind us, I think, because oftentimes when we think about documentation, I think it's something that because it's such a big part of practice and because it takes up so much time, I think oftentimes it can seem like shifting language is actually kind of a small change. But I think just recognizing that through critically reflective practice and bringing this lens to what we're writing, how these very kind of seemingly small, but if they're consistent and if they're intentional and if they're repeated over time, can lead to what Ruha Benjamin, who's a critical scholar, and a lot of her work looks at the impacts of technology and AI, but she refers to it as viral justice. So the way that these small but intentional and collective shifts, in this case shifting language and changing the way we're using documents, can actually really come together and produce lasting change, especially in terms of how children are supported. So not to underestimate the small changes is the point of that. And yeah, I would just like to say thank you all again for coming and joining, and really looking forward to using the last 10 to 15 minutes to talk about this work and how it might show up and how you might have practiced in critically reflective ways already. So open it up to questions, thoughts, comments.